organizers of the summit who offered to accommodate me. Thank you very much. It's my commitment to travel all the way and come and join. And this is because I'm very passionate about hepatitis. To my knowledge, not many doctors have done publications of apps on hepatitis and liver diseases than myself. Sorry, it's not selling I'm not selling myself, but try and find out what I've done for hepatitis B and liver disease on Google Play Store, and you will find a few things there. But today I'm trying to bring something a bit different. I'm grateful for all the presentations that have happened before mine, and I would hope that the kind of cloud I'm building in the sea will be appealing to your purchase. I believe that it is going to be my $1 donation in some way for the care of hepatitis. Next slide, please. Now, those are my disclosures. I've done a few works for the government of Rwanda. I saw Janve, and I was very pleased that he was happy with the slides I gave for the WHO. And also, I will, due to my kind of aggressive behavior on the internet, the GSK found me and felt I should go and speak at the GSK roundtable discussion for Europe in some way. So that's something. And I also coordinate on social media, which is a place that most doctors don't want to be. About 14,000 people on Hepatitis Nigeria network. And so I'm quite comfortable there. And then I produce several apps. Okay, next slide, please. Right, so the importance of role sharing to curb hepatitis B in particular is because of the high prevalence. There's no doubt, we all agree that hepatitis B is very highly prevalent in all countries. There's definite liver cancer risk, and vertical transmission is a major challenge. Next slide, please. Well, there are challenges. I am not going to reinvent the wheel by explaining the fact that we have limited healthcare infrastructure, the high treatment costs, vaccine access can be a challenge for many, especially because there is poor knowledge. Stigma, as thank God, there was so much discussion about stigma before mine, so that is not debatable segment. Gaps in curbing vertical transmission exist, and then access to screening is a challenge. Thank God we're told that when you go to donate blood, you have a free screening. So let's all go and donate blood. Next slide. Now, digital health records are being rolled out across health centers in Africa. I know in particular in Nigeria that this is ongoing at a very fast pace. And so if we are implementing these records can enhance patient care by providing healthcare providers with easy access to patients' medical history. And so if we then ensure that the patient will then receive adequate care and at the right time. Digital records can also facilitate data sharing among healthcare professionals. And therefore, if all carers can actually access a patient's data real time, and which data will be available for epidemiological kind of assessment and even presenting to funders, I believe that we will curb the problem and the menace of hepatitis B in particular within the time frame that we're defining. Next slide, please. Well, everywhere you turn, there is telehealth, teletriage, teletreatment, tele-whatever, telebed. You can have so much. Next slide. So you can show me a home in Africa without a mobile phone. Ask, does anyone here know any house that doesn't have a mobile phone, a smartphone? There is everywhere. So why are we not using it? There are dozens of apps that provide access to care. And so these are all available. So why aren't we using it? We need to teach, we need to speak, we need to use these systems in order to intervene. Next slide, please. Well, if we use the available technology, we can then hopefully achieve things. Everywhere, there are so many connections. We're connecting wires all over the place, and there are internets and so much. We're investing in so much social media excitement. And why can't we do that for hepatitis B? Next slide, please. Well, we can also leverage on technology for continuing professional development. I have had, personally, in my own experience, had some education programs free of charge to colleagues. And I've also had a kind of a multidisciplinary system discussion on complex cases. And I've advised a few people about hepatitis. And For the problem of stigma, a lot of people living in Europe, particularly of African descent, have actually secretly connected with me, and I've advised them, especially in regards to international labor organization issues with stigmatization. Next slide, please. Machine learning will rely only on data, and we are talking about machine learning. Why is the data? We need to have that. How can we? We need to do something about that. So before we can convince people, we definitely have no escape than getting our data together. And that's the only way we can go to Hepatitis Fund, Global Fund, or whoever it is. They would first want to hear our story. Where is your data? Next slide. Success stories of Egypt and Rwanda stem from sorting the bottlenecks associated with the supply chain. And this is a key. We definitely, if we must replicate the success stories of Egypt, we've got no escape than to definitely move faster than we are moving at the moment. Next slide, please. So again, I talk about the plethora of social media where the patients are. We need to go to where they are. They spend a lot of time. The screen time of an average person in this era, post-COVID era, let us say, is a lot. And if you pop in some information about hepatitis, they are more likely to get it. So we need to be there. We need to make videos. We need to produce a lot of information out there. Next slide. Next slide, please. Well, there are no more barriers to exchange of knowledge. International collaboration is key. After my walk at 5 p.m., the only thing that takes me away from the PC is sleep. And what do? I am coding. What do? I'm teaching someone. What do? I am answering queries about hepatitis, liver disease, and so many other things related to my field. Why can't we use it? Next slide. Our laboratory scientists can be supported to discover, validate, and roll out new management strategies for hepatitis B. A while ago, I read about Ghanaian scientists discovering cure, which of course, I had produced a YouTube video against that because the way it went about it, I was against it. So I thought, and of course, if those scientists are quite keen, we could support them. We can bring them out to the round table and find out, what did you do? How did you do it? Can we discuss, is this robust enough? Should you have gone to the social media to talk about what has not been validated? These are things that we should talk about. Next slide, please. Now, policymakers would play a major role. So everybody is involved in this matter. We need policymakers, we need policies, we need guidelines, we need regulations, we need rules and standards, we need to break the supply chain, political will, and so on. Next slide. Now, what have I been saying? Next slide. Well, here is an algorithm that I propose. Again, I'm building clouds inside. Instead of on the sky, I'm building it on the sea because I'm not sure. And I hope someone would push those clouds up into the sky in some way. I am thinking a little bit about a divergence from integrating HIV, hepatitis B care into HIV. Yes, we can do that, but we have an alternative. We can actually go as far low as community health centers. I think about register a patient in a CHO, in a simple clinic. The patient receives an appointment and is confirmed either in a tertiary or secondary center. Then a regular clinician evaluates that patient based on clinical information. Then specialists would review this patient face-to-face and further reviews by telehealth and so on. Sorry, I think you're moving faster than me. That's okay, but let's go on. Well, here is a community health system where a patient can go to. And then they schedule an appointment. That is, even if they can't do anything, they can schedule an appointment with the patient and then move on to registering with details, minute as much as it can be. Next slide, please. And then when appointments are done, the patient, of course, you can see I put myself there, will then have details on that system. And that patient is then populated with every detail. And once the clinician sees the patient, they will update that information based on all the information that is provided. Next slide. The summary of consultation is made accessible to all stakeholders, including data scientists, lab scientists, the pharmacists, and everybody would know about that. And then you can, next slide, please. When the patient's details can always be accessible, I had added schedule appointment, prescribed medicine, and as well as request a laboratory test on that patient. And whatever medication is prescribed, they go to the pharmacist, and everything is contained in the database. Next slide. And of course, a forum is available to discuss cases. Stakeholders may ask questions, difficult ones, or even simple ones, and this can be done. Next slide. Well, what are the take-home points? Of course, if time allowed, I was going to do a demonstration of how this would work in real life, but let's just go through the take-home points from, if you've not heard anything from me, just listen, that just leveraging on the primary health care structures that exist in many countries in Africa to be able to role share about how we care for patients with hepatitis. We can strengthen the patient-professional linkage in social media and so on. We can also integrate telemedicine services, sending text messages, or even sending just simple messages, reminders, clinic appointments, and so on to these patients. We can have planned reminders and text alerts. We can have integrated patient and healthcare professional education system where we can actually work together. We can enhance accessibility to pharmaceutical and laboratory services, and then embrace technology to be able to ensure that there is adequate patient education, and with which I believe the issue of stigmatization would go to near zero. Next slide, please. Well, do I have questions at this point? Next slide. And I thank you very much for listening to my babbling, and I do hope that you buy it. If you think, because I would be a fool to believe that the whole of Africa would go ahead and exhibit what I've said. But I believe that specific countries that are interested might want to connect with me in some way, and we can share ideas. Even if you want to take it free,